Healthy Living in the Four Corners is brought to you by Southwest Eye Consultants. Are you experiencing blurry vision or seem to be seeing double? Do you have trouble seeing well at night? You may be experiencing the development of cataracts, a condition that affects 1 out of every 2 people after the age of 60. We asked Dr. Mas Fenberg with Southwest Retina Consultants of Durango about cataracts and the latest technologies that are available to replace them and improve your vision.
So as we age, there is a natural clouding that happens in your lens inside your eye. Your lens is a clear crystalline protein that helps to, of course, focus light inside your eye. As the birthday candles come, we tend to have less ability for that crystalline lens to focus or move, which changes our focal point, meaning our arms are not long enough anymore. We can't quite bring images as close as we want. And also, there's a general clouding that occurs so that light is no longer distributed through the lens equally, and we start to develop opacities there in the lens. And we go see our optometry colleagues who make our glasses and do our comprehensive evaluations. And they say at some point, well, I'm sorry, I can't get you back to 20/20 any longer. You need to go see an ophthalmologist and consider cataract surgery. Cataract surgery is the removal of that hard, cloudy, crystalline lens in your eye and the replacement of it with an acrylic or plastic implant that is designed to focus light where it should. And so, although that may seem strange to think about an implant inside your eye, it's a lot like an implant to replace a different part of your body that isn't working well. Your eye is essentially measured like a fitting for a shoe. And all of the angles and curves and length of the eye are brought into consideration. And then a lens is chosen that is right for you. And that new lens then focuses light properly in the eye again.
Cataract surgery traditionally has been performed by hand, with surgeons magnifying the eye with a microscope. Dr. Fenberg also employs laser technology to ensure the finest precision possible.
With laser-assisted cataract surgery, before the physician does anything, the laser makes that incision with a laser essentially. The laser then opens with a perfectly round capsulotomy here on the center of the lens, the capsule, and then the laser sculpts this lens into multiple pieces. You imagine cutting a pie into multiple wedges. It's all broken into those pieces, but not removed. So then the patient is moved under the microscope with the physician. These incisions that have been perfectly made with the laser are opened. The capsulotomy is essentially removed because it's already been placed perfectly in the eye. And then with much less power and much less manipulation, each of these little quadrants is removed from the eye of the lens. And then you begin the process of on the table, measuring the patient one more time to ensure that the lens you've chosen is a proper lens. So the lens is essentially loaded by my assistant on the table into this very thin profile like a scroll. And so it's smaller than that 2 millimeter size. It goes in the eye like a scroll, all rolled up. And then once it gets into your eye, your body temperature starts to heat up. Well, it doesn't, your body temperature isn't hot, it's just hotter than the operating room. Once the lens goes into the eye and your normal body temperature starts to impact that lens, it then rolls and opens into its own natural configuration, which is much larger, of course, than that incision. And it has 2 little arms that hold it out and stretch it and keep it in its centered position where it should be.
Most health insurance covers cataract surgery for traditional lens replacement. But if you're willing to spend a little more on out-of-pocket expenses, you may be a candidate for one of 2 types of specialty lenses. The multiple focal lens can give you both close-up and long-distance vision, and the more common toric lens can correct astigmatism.
Patients who have large levels of astigmatism, who may have had to have worn a contact or a rigid contact, a gas-permeable scleral lens, things like that, those patients are amazed because they're out of their contacts. They've now corrected their astigmatism with something inside their eye, and their distance vision is excellent. Now, they don't have near vision with that lens, but many of them are okay with that. They want what we refer to as custom distance. They want the clear, beautiful distance vision, and they're okay having near vision. Some of them are okay wearing glasses still with almost no correction above, but with a bifocal below, and they just like the ability to take those glasses off when they need to ski or do whatever, and still have great distance vision and put them on for their near work. With a multifocal, or what's called an enhanced depth of field lens, you now bring in your world much, much, much closer. You can, pick up the things in the grocery store, read the price tag. You can read most things that you need in your world. If you're doing something like tying flies or reading the fine print on a pill bottle, well, you may need to put a pair of readers on for fine work. But for most of your activity, you're able to do that. These lenses work by essentially casting multiple images onto the retina. And your brain then learns to ignore the image that's out of focus for the given distance that you're in.
Dr. Fenberg warns that patients who elect to have one of the specialty lenses implanted in their eyes will need to be evaluated first to ensure that they're a good candidate, both physically and emotionally. Adjusting to the new lenses can take time.
I tell patients, we change your visual system instantly when we do cataract surgery, and it takes some time to adapt to that. So if I go and get a new pair of glasses from my favorite local optometrist, no matter how well I actually see when I put them on, they tell me I'm 20/20, I'm still not adjusted yet. I don't like them initially because the astigmatism's a little different and the focal point and the size, and it just takes a little bit to adapt. And so they always tell you, I'm sorry, you got to give it a couple weeks and see how you do before we make an adjustment. With surgery, we do that permanently and instantly, and we take your patch off the next day. And for most patients, they're not quite certain how great it is initially, but by a few days to a few weeks, they're loving it. They are loving their spectacle independence.
If you'd like to know more about cataract surgery and the options available to you, contact southwesticonsultants.com. I'm Deborah Urota for Healthy Living.